With 43 aye, 19 no, 2 excused, and 1 vacancy, Senate Bill 2 is adopted.
With that vote, State House lawmakers are sending a bill to the governor that would restore access to Planned Parenthood for Medicaid patients.
It is about access to care, no matter what.
Democratic Representative Jenny Wilford says this bill would allow state funding to cover Medicaid reimbursements at Planned Parenthood that were done on a federal level before the big beautiful bill cut that off.
We have state dollars that we can spend on Medicaid, and we are going to spend state dollars to ensure that Medicaid patients have a continuity of care and are never cut off from the access to resources and care that they need and deserve.
Wilford is one of the bill's sponsors. She says she turned to Planned Parenthood for birth control and healthcare screenings herself years earlier.
If you have ever gone to a Planned Parenthood clinic in order to receive care, I invite you to stand up. I was blown away by the number of my colleagues that stood up. It not only confirmed what I knew, but it showed the entire chamber that Planned Parenthood is an absolutely critical part of our healthcare infrastructure and continuum of care.
Not everyone agrees.
It was an easy vote no.
Republican Representative Brandy Bradley says they're here to trim the fat off a big budget, not spend. Bradley says that money could be better spent funding rural health care services instead.
There's not a lot of, if any, Planned Parenthoods in the rural parts of our state. And I just find it inexcusable that we're going to give $4 million to one entity when there are health care facilities that are struggling or closing their OB wards right now.
Jack Teeter at Planned Parenthood of the Rocky Mountains says the care they offer is critical.
For a lot of our patients, especially in rural areas, our patients in Cortez, our patients in Salida, we might be the only place in their community to be able to access those primary care services, to access subsidized birth control. And so if those patients can't come to our health centers, it's not realistic to think that they'll just be absorbed by other providers in the community. That's not the case.
Right now, there's a preliminary injunction in place. And to be clear, the state money will only be spent if that injunction is eliminated. And the Medicaid dollars would go to reimburse Planned Parenthood for health care services, not for abortion. That bill will now go to the governor for his signature. Rachel Krause, 9 News.
All right, Rachel, thank you.